I've got an interesting question here, or a comment from a subscriber, so I'm going to reply to this one. Help! My GI doc wants to surgically remove my colon, or parts of my colon, or he wants to cut out parts of my intestines because the pharmaceutical drugs aren't working anymore. Please help me. So it looks like this person took a gut motility test, and the GI doc wants to cut out sections of the bowel that he or she doesn't deem to be working properly. So I've regularly seen patients over the years that have been under the knife, for all sorts of weird reasons. Surgery's come a long way, and these surgeons perform incredible jobs, absolutely incredible jobs when you look at it. But it's becoming now microsurgery, very small keyhole with tiny little lenses they can see through, and it's quite different from the old days when they literally slashed people open, and but I want you to remember something interesting. Around 1900, I think it was in New York, hundreds and hundreds of operations were performed on patients. This is only 100 and something years ago, 120 years ago. Hundreds of operations were performed to remove parts of the colon because the person was constipated. So back then, if you couldn't poop, and the doctor would refer you to a surgeon, they just chop a bit of the bowel out, and of course then you'd be pooping like a racehorse, like a duck. Okay, so you went from one extreme to the other. So it was quite common. If we go back to the 50s, it was very common to take tonsils out. Lots of people just had their tonsils taken out. You got, we better take that tonsil out. So it was very common. If we go back further, the thymus glands were removed from kids' chests before that because they thought they were useless organs. And many doctors still remove appendices and and things that they say, they're probably useless. So no part of the body is useless. Surgery is never something I ever recommend for people to take lightly. It's only as an extreme last resort. So what the person's saying here is because the drugs aren't working, or maybe the GI doc's not working. Okay, maybe the guy's got a glass of wine in hand, a golf club in the other, and he can't be bothered looking at you or talking to you as a patient. You need to find an alternative medicine, doctor. I still, for the life of me, can't work out why they use the word alternative. Drugs should be the alternative, okay? We should be seen as primary, all right, not alternative. So when patients have dysfunctional gut function, first port of call is a naturopath, not the GI doc. That is, if the naturopath's experienced and trained also in medical and understands the severity of GI complaints. Acute abdomen, of course, is straight for the emergency room, but a chronic ongoing one is best kept away from the doctor unless the patient wants to feel sicker. Docs are no good at long-term chronic gut complaints. I've worked that out. They're great for acute. You get a burst appendix, well, you're not going to go to a chiropractor with a burst appendix, are you? You're probably going to go to a GI doc. That's exceptions. There's always exceptions. But when we get irritable bowel syndrome and gas and bloating and constipation, these functional disturbances need to be nailed down there and then. They need to be fixed up in the early stages and not left until pathology develops over time. Right? Playing the fiddle while Rome burns is not a good idea. You need to get onto the fire before it engulfs the whole city. Inflammation starts often in the GI tract and slowly spreads its way out to the rest of the body. Doctors have not got the training to understand on the proper treatment and assessment and treatment of functional GI disorders, and that's a fact. And I don't care what comments I get on this video. I've been in this business long enough to know that you don't go to an average doctor for a gut complaint. You're better off going to someone who knows stool testing and come up with diet and some supplements instead of drugs like antibiotics to get the gut in order. So what are we going to help this person with? Surgically remove my colon. Well, I would highly recommend that this person go and seek the aid of an experienced functional medicine doctor and likely get stool testing completed and not have any surgical intervention until it's absolutely necessary. These are the sort of patients I've seen over the years that had they hadn't seen me, they would have had their bowel removed or part of the bowel removed. I've seen many cases like that, and all these patients generally required was a proper stool test, a good analysis of the results, and then a treatment. It either involved reducing inflammatory markers in the gut, or it could have involved working on a yeast problem we saw there, or a bacterial issue, something like that. And generally that's when the pain goes down. But it could also mean another issue. This patient needs checking out. there could be some other type of issue going on there with the gut. And often these things can be found out again through appropriate functional medicine testing. So let's put the knife away for now, all right? And let's get a proper assessment of the gut from a functional perspective before we start playing with knives. Because once you pull the knife out the drawer and start making cuts, unfortunately you can't really sort of put that bowel back together again. Yeah, my father-in-law had major problems with his gut for so long. He had bottles of PPI drugs lined up in his shed, like 2 feet of PPI bottles just sitting there because he had so many gut problems. But when I saw what the old man was eating and drinking, I soon realized where the gut problem came from, right? Cause and effect. So again, in this patient's case, the patient needs a lot of work with the diet and the lifestyle to remedy these things, to prevent the knife now and also to stop the knife in the future. Because once you cut, you can't go back. That's how it is. Thanks for tuning in. I always appreciate viewers and subscribers. Thank you.